My name is Sandra Rojas, and I am from Rockford, Illinois. When I was like 17 years old, I went out to look for a job, and I went into a local children's home, got to meet the children, and right there and then I knew I wanted to be a nurse and to take care of children. I knew that was my calling, and I knew that is what I was born to be, a pediatric nurse. I love to see their smile when they see my face and know that I have made a difference in their lives, to make them comfortable, to make them pain-free. My faith has been an important part of my life, and I think it's helped in my nursing career to try to help other people. I've been in pediatrics for almost 40 years, and I had worked the past 18 years at the county health department. I had received Employee of the Month and then Employee of the Quarter. I also had received a certificate for translating, which I think benefited our clinic to help translate for the underserved in Rockford.
In 2015, the county's new public health administrator decided to merge the pediatric clinic with the women's health services. And then she mandated that all nurses refer for abortion and provide abortion-inducing drugs.
I was given two choices: to violate my faith and my oath to do no harm, or to lose my job in the clinic. I was hurt and I couldn't believe that this was happening. I had worked there for 18 years and I had loved my job working in pediatrics. I had agreed and trained to do everything else in the clinic, and I was, but because I could not do abortion-related services, I was fired.
The decision to force Sandra out of her job as a nurse had nothing to do with her performance. In fact, the new administrator said that she was a good nurse. She was forced from her lifelong calling solely because of her religious conviction that she could not take a person's life.
Losing my job, I lost my income, my ability to support my family. That put a lot of stress on me. I felt it financially because I could no longer afford to pay for my son's college education.
Sandra came to us for help when she was fired from her job for refusing to refer mothers for abortion. Thankfully, in Illinois, there's a law that protects pro-life healthcare professionals. The law allows them to ask the court to protect their rights in the event their employer is forcing them to choose between their belief that all life is sacred and their job.
For many doctors and nurses, their only real recourse under federal law if their conscience has been violated is to file a complaint with the U.S. Department of Health and Human Services. But because this process can often take months or even years, many healthcare professionals live in constant fear of losing their jobs.
The Conscience Protection Act was introduced in the United States Congress in 2017. If passed, the law would ensure that healthcare providers that receive government funding do not discriminate against doctors and nurses who cannot take part in abortion. The law would also provide healthcare professionals the ability to defend their conscience rights in a court of law, a remedy that has long been available for victims of other civil rights violations.
I believe I did make the right decision, and I would never change it. I believe that I need to teach my children to do what's right and that they would follow my example. I want other people to believe that they have the right to stand for their conscience, for their beliefs. Well, I hope my story will help other medical personnel know that they can stand up for their rights and that no other nurse or doctor goes through what I went through. I think everybody should have the right not to go against their conscience or their beliefs, and it should be honored. What makes America unique is our ability to live out our beliefs. The Constitution protects that freedom. I don't want the government to take that away from me.